A renowned name in the field of pathology, Edward P. Fody, MD, has devoted more than 30 years to the education and practice of this branch of medicine across numerous universities and medical facilities. Although he is currently semi-retired, he remains extremely invested and active in his chosen field. Born and raised in Baltimore, Maryland, Dr. Fody has always had an interest in science and knew from a young age that he wanted to study cancer. After he graduated from high school, he pursued his professional path by earning a Bachelor of Science at Duke University in 1969, and followed that up with a Master of Science from the University of Wisconsin in 1971. It was while obtaining his degree in Wisconsin that he studied the impact of chemical compounds on cancer therapy, which would inform the rest of his career as a physician. He bolstered his academic expertise further in 1975 when he graduated from Vanderbilt University with a Doctor of Medicine. Upon completing his higher education, he acquired hands-on experience as a resident in pathology at Vanderbilt University Hospital from 1975 to 1978, leading to a fellowship in chemistry at the University of Texas Medical School from 1979 to 1980. Dr. Fody discovered his love and natural ability for teaching in 1980 when he became an assistant professor of pathology at the University of Texas Medical School. After a year, he balanced the roles of associate professor of pathology at the University of Arkansas Medical School and laboratory chief of the Veterans Affairs Hospital in Little Rock from 1981 to 1987. He then served as the chief pathologist at Bethesda Hospital in Cincinnati from 1987 to 1996 and at Erlanger Medical Center in Chattanooga from 1997 to 2004. He found his most recent success as the Chief of Pathology within Western Michigan Pathology Associates at Holland Hospital in Michigan from 2004 to 2013. While he has worked part-time as a pathologist with specific focus on tumor diagnosis and genetic diseases at the hospital since 2013, he is currently looking toward full retirement. Upon reflection of his accomplished and impactful career, Dr. Fody is most proud of improving laboratory services to improve patient care. Outside of his primary endeavors, Dr. Fody has also lent his expertise as the editor and co-author of Clinical Chemistry, Principles, Techniques, and Correlations, an acclaimed text originally published in 1984 that has served as a student-friendly guide to its subject for going on 9 editions now, with the next publication releasing in 2022. He has also remained connected to his field through memberships with the College of American Pathologists, the American Society for Clinical Pathologists, the American Medical Association, the American Association for Clinical Chemistry, the American Society for Microbiology, the Michigan State Medical Society, and the Ottawa County Medical Society. In addition, his continued affiliation with his branch of science extends to improving patient care as an advocate with several professional groups, including these. Looking toward the future of his industry, Dr. Fody noted that the biggest thing on the horizon will be the promises of molecular medicine, which is now starting to be realized. In the next 20 years, he feels science will see big changes because of what molecular pathology is going to do for the benefit of everyone. He also foresees that future professionals in pathology will be faced with such challenges as staying ahead of government regulations and keeping up with third-party insurance companies in a struggle to get paid for what they do. Hoping to be remembered by his peers as someone who made laboratory work for them and their patients, Dr. Fody enjoys boating, photography, and spending time with Nancy, his wife of more than 40 years.